You will discover 5 science-backed blood tests that estimate biological age, so you can target what truly improves your sleep, energy, heart, and brain. By the end, you will know how to turn your lab numbers into action, stay safe, and age gracefully, with extra tips you can use today. Most of us count birthdays, but we miss the silent signals that our cells might be aging faster than the calendar. That gap matters, because faster biological aging links to earlier disease, lower resilience, and shorter health span, even when routine checkups look fine. The solution is simple. Translate blood data into aging signals using validated models that compress complex biology into one age estimate, or a yearly PACE. When you convert labs into these aging scores, you can test changes in sleep, nutrition, stress, and training, then see if your pace of aging slows. We will show strengths, limits, and confounders, so you avoid overpromising, protect your wallet, and safeguard your privacy. We will also show when a test is best for trends, not for diagnosis, and when a clinical visit is the right move. Stay to the end for fair retest tactics, such as drawing blood at the same time of day, hydrating well, and avoiding hard workouts for 24 hours. We list peer-reviewed sources at the end, so you can check the evidence yourself. If your last blood work looked normal, yet you feel older than your years, would you try a data experiment to nudge your age meter down? Some tests report age in years, others report speed per year, and reading them together creates a clearer dashboard. Hidden variables can blur the picture, such as illness, poor sleep, alcohol, dehydration, and strenuous training, so you will learn how to control them. This video is educational and does not replace medical care, so please work with your clinician for symptoms, conditions, or medication decisions. Keep short notes on sleep hours, stress level, steps, meals, and new supplements so you can link cause to effect instead of guessing. Ready to choose a dashboard for the next 3 months and to pair it with simple changes you can keep without gimmicks or hype. DNA methylation clocks, GrimAge and DunedinPACE. You feel strong on the outside, yet something feels off inside. And you want a clear number to show if your lifestyle slows aging or speeds it up. DNA methylation clocks read chemical tags on DNA from a small blood draw and convert them into an estimated biological age, or a speed of aging. The best studied tools include GrimAge, which estimates age in years and health risk, and DunedinPACE, which reports pace per year with 1.0 as average. DunedinPACE is centered at 1.0 by design, so values below 1.0 indicate slower biological aging, and values above 1.0 indicate faster. These clocks are trained in large cohorts and associate with risk beyond calendar age, acting like flight data recorders for your body. If your DunedinPACE is 0.95, you are aging slower than average, so keep what works, then confirm in 3 to 6 months. If your DunedinPACE is 1.10, you are aging faster than average, so upgrade sleep, stress control, fitness, and diet, then retest in 3 to 6 months. These tests are not diagnoses, and they are sensitive to smoking, alcohol, heavy inflammation, and blood cell mix, so focus on trends, not single points. These clocks are best used as trend tools for lifestyle experiments, not as medical decisions, and unusual results should be discussed with your clinician. Time your draw when you are well, after a normal week, at the same hour of the day, because illness or a sleepless night can distort the score. Studies report that GrimAge associates with all-cause mortality and disease risk beyond chronological age, and DunedinPACE quantifies the pace of biological aging, adding information beyond GrimAge. Helpful upgrades include a regular wake time, a cooler, darker bedroom, fewer late drinks, more fiber and protein, plus 2 strength sessions weekly if your clinician agrees. Next, we move to a low-cost model built from routine labs, which you may already have on your report, so you can start today. Phenotypic Age from routine labs. Your labs may be normal, yet your recovery, sleep, and stamina feel off, and you want a number that matches how you actually feel. Phenotypic Age converts 9 common markers, plus your calendar age, into an estimated biological age linked to risk in large population cohorts. The 9 inputs are albumin, creatinine, glucose, C-reactive protein, lymphocyte percent, mean corpuscular volume, red cell distribution width, alkaline phosphatase, and white cell count. The model outputs years, which can be older or younger than your calendar age, and that gap is the signal you can influence with daily choices. If your phenotypic age is 5 years older, tighten bedtime, reach at least 7,000 steps, hydrate, target protein, and add 2 resistance sessions, then repeat labs in 8 to 12 weeks. If your phenotypic age is younger, keep your routine and protect it by staying consistent, while managing short-term stress that can bump C-reactive protein and white cells. Expect meaningful change over 1 to 3 months, since blood cells renew on cycles, so judge experiments on that timeline, not day-to-day swings. Cautions include illness, dehydration, alcohol, a hard workout the day before, and crash dieting, which can skew several markers for days. Performance can vary across ancestries or conditions because the model was trained in United States cohorts, so focus on trends and discuss outliers with your clinician. Build a base with regular sleep and wake times, whole plants, lean proteins, omega-3 rich foods, and 2 weekly strength sessions, if your clinician agrees. Use movement breaks to avoid long sitting. Aim for protein near 1.2 to 1.6 grams per kilogram, or 0.55 to 0.73 grams per pound, and log your meals. Stay hydrated, limit late alcohol, and avoid new supplements for 7 days before testing to keep your baseline steady. Love this video? You'll enjoy what's linked in the description too. Don't miss out. Next, we map hidden inflammation inside the immune system, because it can push biological age higher, even when other labs look good. IgG glycan clock for Inflammaging. Slow burn inflammation raises disease risk years before symptoms, and chronological age cannot see it, even when your body feels older. A practical option is the Glycan clock, which reads sugar branches on IgG antibodies from a blood draw, because those glycans shift with age, hormones, and immune balance. Large cohorts show that a small set of IgG glycans can estimate age with roughly plus or minus 10 years, varying by assay and population, and that older profiles align with higher inflammation and metabolic strain. Unlike fixed genetics, IgG glycans respond to lifestyle, so improving sleep, fitness, nutrition, and stress can shift the profile toward a younger pattern over months. If your glycan age is 5 to 10 years older than your calendar age, increase colorful plants, add 2 strength days, and build an evening wind down that lowers cortisol. Acute infections can temporarily worsen the glycan pattern, and female hormones can shift it, so time your test away from illness and discuss therapy with your clinician. If your score is younger, protect it by staying consistent and watch sleep, alcohol, and oral health, since each can nudge inflammation within days. Assay methods vary across labs, and the field is evolving, so treat deltas, not absolutes, and avoid chasing tiny changes within noise. Pair the glycan clock with high-sensitivity C-reactive protein and white cell count, because all 3 together reveal low-grade inflammation more clearly. A simple week might include fiber-rich breakfasts, vegetables, olive oil, fatty fish or flax, walnuts, 2 strength sessions, and brisk walks most days. Join our community and never miss out on new content. Subscribe today. Next, we add an AI blood clock for low-cost trending, and we clarify how telomere length fits into a realistic plan. AI blood clock, telomere length, and your plan. Many viewers want an easy way to track progress without overreading one number, and this approach keeps it practical. An AI blood clock learns from routine chemistry and blood count markers to predict calendar age, and to act as a trend tool alongside your care. Since 2016, studies have predicted age from common lab values, and higher blood clock age often tracks with frailty and worse outcomes, which is useful for direction, even if rough. Algorithms differ, may not generalize to every population, and most were built to predict calendar age, so treat the output as a proxy for system strain, not a verdict. The 5th blood test is telomere length in white blood cells, which are protective caps at chromosome ends that shorten with cell division and stress. The most reliable clinical method is FLOW-FISH, and the clearest use is diagnosing short telomere syndromes that can change transplant or drug choices, while a single reading in healthy adults is noisy. Outside suspected short telomere syndromes, Single telomere readings in healthy adults should be interpreted alongside phenotypic age and methylation pace. If you plan telomere testing, avoid illness. Repeat with the same method months apart and log sleep, stress, training, and infections to explain movement. Use methylation clocks for a higher signal overview, pair with phenotypic age as a low-cost lever, add a Glycan clock for inflammaging, and consider an AI blood clock for trends. Hydrate around 30 milliliters per kilogram, or about 14 milliliters per pound, and target protein near 1.2 to 1.6 grams per kilogram, or 0.55 to 0.73 grams per pound. Treat these as rule-of-thumb targets and personalize with your clinician, especially for kidney, liver, or heart conditions, or medicines that affect fluid and protein needs. Retest every 3 to 6 months for low-cost panels, and every 6 to 12 months for methylation or glycan tests, and discuss extreme numbers with your clinician. Act by choosing one sleep lever, one nutrition lever, and one movement lever for the next 30 days, then retest, and keep what worked. If this framework helps, save the video, share your progress, and help someone over 40 turn data into momentum without hype. Are you over 40 and living your best life? Share your inspiring story with the world. And spread positivity in the comment below. Decode your cholesterol test. And learn what most doctors overlook after age 40. Let's watch the next video here.